speak. And thanks to the Saskatchewan Seniors Mechanism, you can see the title of my presentation is Does Wearing a Face Mask Affect Ability to Perform Exercise? So as Holly mentioned, it's quite a controversial area. And throughout my presentation, I'm going to try to stick to the scientific literature. So I'm going to try not to deviate from that and talk about anecdotal experience, but I may have to, for areas of the research that haven't been covered. Just trying to advance the slide here. There we go. So this is an outline of my presentation. So I'm going to go over the importance of masks. I'm going to try to give some evidence for how effective they are for preventing transmission or contracting COVID. Then I'm going to go over the problem of COVID transmission during indoor exercise. And then finally cover the use of face masks during exercise. So whether it's feasible, I'm going to go over the study that we've done at the University of Saskatchewan. But I'm also going to cover some other studies that have been done with different populations and different types of exercise. So masks for prevention and transmission and contracting of COVID. So what is the evidence? I've got this study up because I think this is the study that really swayed the World Health Organization to recommend face mask wearing during the pandemic. So if you recall at the start of the pandemic, it seemed like the messages that we were getting were uncertain whether face masks were actually effective. And I think it was this particular publication that really swayed the World Health Organization to change their recommendation. So this is actually a group from McMaster University. So it's a Canadian group, and it's published in quite a high profile medical journal, The Lancet. You can see that they've taken data from healthcare and non-healthcare settings that involved 2,600 patients. And this looked at people that were wearing face masks or not wearing face masks and treating these patients. And these patients had COVID. They went back a little bit and also looked at patients that had other very contagious respiratory disorders, such as, if you recall, SARS. And there's also MERS, which is the Middle Eastern Respiratory Syndrome. So bottom line, I've tried to summarize a very long paper here on one slide. If you look at the bottom of this slide, your chances of contracting an infection, if you're treating a patient that's infected, was 17% if you were not wearing a face mask and 3% if you were wearing a face mask. So quite a substantial reduction if you were wearing a face mask. So to put this into kind of context, if you're treating a patient, you'd have to treat about 6 patients to get infected if you're not wearing a face mask, and about 33 patients to get infected if you are wearing a face mask. So a couple of other studies I'll go over here, and these are kind of natural studies that happened during the pandemic. So one is aboard this USS Roosevelt aircraft carrier, where you've got about 1,400 American service people, personnel, and they're all crammed together in close quarters on this aircraft carrier. So it's an environment that would really promote the spread of COVID if someone was infected, and that's exactly what happened. So, this is the citation from the study. You can see that about 1,000 of the 1,400 service members became infected on this aircraft carrier. Some of them were wearing face masks on a consistent basis, and then others weren't. And you can see the infection rates between the two. So just over half the people that were wearing face masks became infected, and about 80% of those that were not wearing a face mask became infected. So this gives you an idea of, chronic exposure to COVID in close quarters what's going to happen if you're wearing a face mask versus not wearing a face mask and your chances of infection. This last natural study that I'll go over, again, this is during the pandemic. This study kind of swayed the Centers for Disease Control in the US, to recommend face masks, not only for prevention of transmitting COVID, but also for prevention of catching COVID. So it was a case of two hair salon workers who, I guess they didn't know that they were infected, but they were infected with COVID. And they had worked on 139 clients, so they're, in close proximity to these clients. They're working on their hair, and they spent at least 15 minutes with each client. And both the hairdressers were wearing face masks the entire time, and also their clients were wearing face masks. So in this case, you've got everyone in the room actually wearing face masks and working together closely. And with this highly contagious virus, they saw no transmission from the hairdressers to their clients. So none of the clients actually became infected with COVID. So other questions that are asked about, there's a whole variety of face masks that you can buy out there. So this one neat study looked at which masks are most effective or ineffective. So this is a picture of all the masks that they evaluated. And they evaluated the masks for their ability to stop respiratory droplet transmission. So they measured the amount of respiratory droplets in the air while the person was speaking and wearing these face masks. So it ranged, you can see number one is your standard disposable surgical face mask. Then you've got a variety of cloth face masks and face masks of different materials. And number 14 is your N95 face mask. So that's the most, effective face mask that mostly medical personnel wear. So this graph shows the results of their study. If you look at the green dot on this graph, it's to the right of the graph. That's the respiratory droplet count, outside the person speaking when the person's wearing no mask. So all the masks are rated relative to wearing no mask. And you can see that most of the masks actually perform quite well. So from 0 respiratory droplets for the N95 mask, most of the masks, about 20% or 80% drop in respiratory droplets compared to not wearing a mask. The ones that perform the worst, you can see to the far right, the dot in red is the bandana, and the neck gaiter also perform very poorly. So the neck gaiter, you can see the dot is actually slightly higher than when you're not wearing a mask. So it actually, they thought that it actually made the situation worse. So they're thinking that the material in the neck gaiter, not only let the droplets through, but they made the droplets smaller and made them go further when they're breathed out. So this neck gaiter, the material here is spandex and polyester. So that would be the type of, I would say out of all these masks, it would be the only one, that I'd recommend avoiding. Most of the other masks are made of cotton. Number 3, you even have a knitted mask that was relatively effective. So I mentioned the gaiters because, if you notice a lot of the sports, a lot of athletes like to wear the gaiters. So according to this study, the gaiters are actually not that effective for preventing your respiratory droplet transmission. So one thing to make clear about wearing a face mask is it has to be worn properly. So it should be worn over your, under the chin and then over the nose. So unlike this guy, Someone took a picture of him on a recent flight. Face mask should be worn above the nose as well. So you see a lot of people walking around with their face masks pulled beneath the nose. So this is kind of a meme that's making fun of these people with a fake research study here showing that, it's actually been shown that the nose is actually connected to the lungs. So it's important to actually cover up the nose as well when you're wearing a face mask. So, the problem, that we're trying to address with this presentation is COVID transmission during indoor exercise. Again, there's been a lot of news articles about COVID transmission in gyms and COVID outbreaks in different gyms across the country. And I can go over those news articles, but I've tried to stick to the scientific literature here. So I've just pulled out, a published study that was done in Korea that tracked a COVID outbreak in a number of dance studios. So, they identified enclosed gym spaces as an area that's susceptible to COVID transmission. So the problem when you're exercising is your respiratory droplets go a lot further than just 2 meters. The recommended distance that they recommend for, for distancing, simply because you're breathing harder. So your respiratory droplet is going to go further, and you're more likely to become infected in an enclosed gym facility. This is just another published study, and this had to do with recreational hockey games. So again, just anecdotally, you'll notice from the news reports that there are a lot of hockey teams in Saskatchewan that have experienced COVID outbreaks. So this is a published study, again, from the US, that shows an outbreak on 2 hockey teams after a recreational hockey game. So the graph shows on June 16th, the evening, they played the hockey game, and then each of those bars represent increases each day of people that became evident that they became infected. So overall 15 people. You can see 1 person the day after the game, a few people 2 days after the game, and that carried on for 5 days after the game until they had a total of 15 infected. Some from each team, and also 1 person that was a rink staff member. So indoor exercise may provoke COVID transmission, but it's important, I think, to promote exercise during COVID. People are sitting at home and they're becoming more sedentary, and that leads to increases in risk of, these different disease conditions, type 2 diabetes, obesity, hypertension. Those can all be prevented with proper exercise. And it should be noted that all of these conditions are major risk factors for complications if you contract COVID. So you're more likely to have serious complications and more likely to die if you have these underlying conditions and you contract COVID. So that leads into, the purpose of the study that we conducted was to look at, the use of face masks during exercise. Given that face masks are effective for preventing and transmitting, prevention of transmission and catching COVID, but indoor exercise facilities are an area that is susceptible to COVID transmission. So, that's why we went and looked at the use of face masks during exercise. So we looked at the effects on performance and the effects on different physiological markers that might indicate the amount of stress on your body, and also ratings of perceived exertion. So just asking a person how hard the exercise is feeling when they're wearing a face mask versus when they're not wearing a face mask. So the theory here with wearing a face mask and why it might make exercise more difficult is you're not only blocking, the amount of oxygen that you might be able to take into your lungs, but when you're exercising, the oxygen will eventually go through your arterial blood to your muscle, where it's used to break down, the food products that you eat. So it's used to break down carbohydrates, proteins, fats for energy. Carbohydrates, protein, and fats, they're made up of carbon molecules. And when that combines with oxygen, you get carbon dioxide, which then goes through your venous blood back to your heart and your lungs, and then you exhale the carbon dioxide into the air. So the theoretical hazard of wearing a face mask during exercise is it's not only going to impede the amount of oxygen that you can consume, but it's also going to make you rebreathe some of the carbon dioxide. And the problem with rebreathing the carbon dioxide, and I've got this little cartoon here, is that if you rebreathe carbon dioxide, it's going to displace some of the oxygen in your arterial blood. So this is the blood that goes from your heart and your lungs to your muscles. So this cartoon just represents that you have these red blood cells that usually carry oxygen from your heart and your lungs to your muscles. But if you're rebreathing the carbon dioxide, that carbon dioxide can displace the oxygen. So you get a situation where you have a lower level of oxygen in your blood vessels and you have a higher level of carbon dioxide. So that's the theoretical hazard of wearing a face mask during exercise. So this is the title of our recent publication, and you can see, we kind of summarized the results of the study in the title, in that wearing of cloth or disposable surgical face masks had no effect on vigorous exercise performance. And it should be noted that this study was done in young, healthy individuals. So you can see the authors on this study. Keely Shaw is my PhD student. Scotty Butcher is a professor in our School of Rehabilitation. John Coe is one of my research assistants. Gord Zello is a professor in pharmacy and nutrition at our university. So with our study, it involved 7 active men and 7 active women, that were used to performing bicycle exercise, and they performed a progressive intensity exercise test to exhaustion on a stationary bike. So this type of test is a standard, reliable test to assess your aerobic fitness. It involves first pedaling on a bike at an easy workload, and then as you progress throughout the test, the workload becomes more and more difficult until you reach a point of exhaustion. So an analogy to this would be you're cycling up a hill that becomes steeper and steeper as you go along. So we looked at these 14 participants during this type of exercise test under 3 conditions. One where they're wearing a cloth face mask. So this was a 3-ply cloth face mask, that's recommended by Health Canada. We looked at the disposable surgical face mask. So this is the type of face mask that you can buy in any drugstore. And then we looked at a no face mask condition. These are our measurements. So we looked at exercise performance, how long they were able to go during the exercise test, and also peak power output. We also measured heart rate during the test, arterial oxygen levels, so oxygen levels in your blood, oxygen levels at the muscle, and also ratings of perceived exertion. So with ratings of perceived exertion, we're simply asking the person to rate how hard the exercise feels on a scale of 1 to 10, where 1 is very easy and 10 is as hard as it gets. So this is a picture of our exercise test in the lab. So in this condition, the participant is wearing the cloth face mask that we used. And you can see on the blow-up picture on the right-hand side, on the leg, we've got what's called a near-infrared spectroscopy device. And that device uses near-infrared light to assess the muscle oxygen levels. On the participant's finger, so you can see on the left hand of the participant, one of the fingers, they've got a clip, and that clip is called a pulse oximeter, and that measures the amount of oxygen in the arterial blood. So these are our results. This is the time to exhaustion. So this is our performance results. And you can see that there was no difference between any of the conditions. So the time to exhaustion, you can see the average is just over 10 minutes across the participants. And no difference between the surgical mask, cloth mask versus no mask conditions. Each of these next 4 graphs I'm going to show you have the same pattern. So on the y-axis, I've got the variable that's assessed, and on the x-axis, I've got the percent of peak power during the test. So this is the measurement throughout the entire progressive intensity exercise test. So as you go across that x-axis, the test is becoming more and more difficult. And I've got the no mask condition plotted in the small dotted blue lines, the surgical mask in the dark dotted slash lines, and the cloth mask in the solid red line. So this is arterial oxygen saturation. So this is the amount of oxygen in the blood during the test. You can see that there's a lot of overlap between the conditions, and essentially no difference, no statistical difference between the conditions. Another thing to point out here is that usually you're considered to be low in oxygen if this level falls below 90%. And you can see from the y-axis that on average, our participants didn't really come close to reaching that level throughout the exercise test. This shows the muscle oxygenation index. So this is the level of oxygen in the muscle. So it decreases as the exercise intensity increases. But again, you can see there's a lot of overlap between the conditions, and essentially no difference between any of the conditions, so face mask versus no face mask, at any time point during the exercise test. This shows your heart rate. Again, it's increasing throughout the exercise test because the test is becoming more and more difficult as the test progresses. But again, no difference between the face mask versus no face mask condition at any time point. And this is the rating of perceived exertion. So this is how difficult the participant rated the exercise at different time points during the test. And again, you can see no difference between conditions. You can see at the end of the test, they're at a level very close to 10. So they are working at their maximal intensity by the end of the test. So our conclusions were that exercise while wearing a cloth or surgical face mask had no effect on exercise performance, no effects on any of the physiological measurements we made, and no effects on the ratings of perceived exertion during the test. So questions that have arisen, from this study are, what about different types of participants, so different ages and conditions, and what about different types of exercise, so different durations, intensity, and modes of exercise. So we've been trying to answer these questions by doing an in-depth review of the literature. So we're in progress of doing what's called a systematic review of the literature. So it's a review of the literature that follows a lot of different rules, search strategies, to get an in-depth look at the literature of using face masks during exercise. And surprisingly, there are quite a few studies out there evaluating face mask use and exercise. A lot of them are, from 2020 during the pandemic, when this has become more of a concern. But there are also a number of studies going back years that looked at face mask use during light to moderate exercise in hospital settings. So for people that have to wear face masks, throughout the day, nurses and doctors that have to perform light to moderate, physical activity throughout the day. And also looking at people that might work in industrial settings or settings where there's a lot of pollutants in the air. So there have been a number of studies looking at exercise tests, and we included only studies that looked at exercise tests when using the face mask compared to the same exercise test when not using the face mask. You can see that we've included, we found studies with healthy young participants, one study with children, a couple of studies with older adults, and studies with people that had different medical conditions, including lung conditions, so chronic obstructive pulmonary disease. And we also found a study with people that had coronary artery disease. So I'll be going over all these studies. Overall, these studies included close to 500 participants who were evaluated while wearing face masks compared to no face mask during exercise tests. So these are the outcomes we've assessed. So exercise performance was our primary outcome. And then we've assessed a number of physiological measures, including blood oxygen levels, your carbon dioxide levels in your blood, carbon dioxide levels in your lungs, your heart rate, blood pressure, breathing, and your ratings of perceived exertion. So the exercise tests in the articles we reviewed involve stationary bike exercise or treadmill walking. The intensity ranged from light, moderate, so brisk walking, to maximal, either on a treadmill or a bike. Duration of exercise ranged from 6 minutes to 1 hour. So these are the results. Now, this is what's called a forest plot, and this is what you get when you statistically analyze a grouping of studies. And I'm going to walk you through this. And I've only got this one forest plot for our main outcome variable, so exercise performance. Out of the 15 studies we reviewed, you can see there's 5 of them. They're listed on the left-hand side that actually evaluated exercise performance. So what I've got circled here are your results for your face mask versus no face mask condition for each study. And each of these studies is quite different with regards to their exercise testing. So that first study, Carazol 2020, I'll be talking about this study a little bit more in detail because this one involved older adults that were doing stress testing on a treadmill. So the number you see, 8.77 versus 8.76, it's a measurement of the amount of work they were able to do on the treadmill, either wearing a face mask or no face mask. And you can see the numbers are almost identical between the two conditions. The Epstein study was a progressive exercise test on a bike that was very similar to the type of test that we did for our study. And the numbers you see there, 18.3 versus 18.9, that's the amount of minutes they were able to exercise on the bike before exhaustion. Again, you can see very little difference between the face mask versus no face mask condition. The Thickenser study, again, that's a similar test. It's a progressive intensity bike exercise. And the numbers there, 269 versus 277, that's the maximal power output they were able to achieve during the test. So 269 for the face mask, 277 for the no face mask condition. The person study is a 6-minute walk test. So this is done in young, healthy individuals, and they're simply walking as fast as they can to cover a maximal distance over 6 minutes. And the numbers you see there, 708 versus 708, is the amount of meters they were able to cover in 6 minutes. So again, you can see an identical exercise performance in the face mask versus no face mask condition. And the last one is our study, and that's just the time to exhaustion during the exercise test for the face mask and no face mask condition. So to crunch these numbers, you can see on the right side of this figure, there's a graph that shows these green squares, and then at the bottom of the graph, you've got this black diamond. Those green squares represent the results for the individual studies. That vertical line that goes through the 0 point would indicate no difference between face mask versus no face mask conditions. That bottom black diamond represents the average across all the tests. You can see that it's right on the 0 line, which indicates that there is absolutely no difference between the face mask versus no face mask conditions. So, you know, one criticism of our study was it involved only 14 participants. This is, you know, results of exercise tests for people wearing face masks that involves 150 participants. These are just the summary results for other variables. So no significant changes in blood oxygen levels across all studies when they were all combined. The N95 masks, so these are the masks that are usually just worn by medical personnel. Not very many people in the public will wear these while exercising. But if you do wear them while exercising, you can see that they do increase your blood carbon dioxide levels. Surgical masks do not have the same effect. Heart rate is significantly increased with the N95 mask during exercise, but not with surgical masks. No changes overall in blood pressure across studies, no changes in breathing measures, and a slight increase in ratings of perceived exertion while wearing face masks across all studies versus when not wearing face masks. So summary, wearing masks during exercise increased rating of perceived exertion. So people felt like the exercise was more difficult while wearing face masks. Wearing a more restrictive face mask, so the N95s, increased blood carbon dioxide levels and heart rate, but this did not translate to an effect on blood oxygen levels or exercise performance. So even if you're seeing some of these physiological changes, they don't seem to affect your, your ability to take up oxygen, and they don't affect your ability to do exercise. Now I'm going to look at just a couple of the studies from our review that focused on older adults or adults with chronic conditions. So this is a study that looked at the use of N95 face masks during people that had chronic obstructive pulmonary disease. And they had them doing a 6-minute walk test. So this 6-minute walk test, they asked the participant to walk as fast as they can to cover the maximal distance that they can over 6 minutes. And they evaluated 97 participants. You can see their average age was about 68 years. They wore the N95 mask during one test, and then for the other test, they wore no mask. And 7 out of the 97 failed to complete the test while wearing the mask. And it was the patients who had more severe disease. So this is measured as a forced expiratory volume in 1 second of less than 30% of predicted. So this is just a standard test of lung function. And then for the other 90 participants that were able to complete the test, they found that they had a slightly increased risk of heart rate while wearing the face mask. Their breathing frequency was slightly increased, so 2 breaths per minute. They had a slight increase in lung carbon dioxide levels and a small reduction in blood oxygen levels of close to 1%. So not really big changes in their physiological measurements. So note that these results were with use of the N95 mask. As I mentioned, these are the masks that are usually used by medical personnel, and they're not really used that often by the general public. There is a recent study that looked at the same type of exercise test, so 6-minute walk test, with patients, again, that had severe chronic obstructive pulmonary disease, and they found no problems with the patients completing the test while they were wearing the disposable surgical masks, so the masks that are a little bit less restrictive. The last specific study that I'll focus on, and this one is very recent, so just in the last couple of weeks. This comes from a research group that is conducting stress tests on a regular basis for screening of heart disease. So if you're not familiar with the stress tests, usually if you want to screen for heart disease, you have to make the heart work harder, and then you can detect whether there's, you can detect more easily whether there's a problem with your heart if it's under an exercise stress versus when it's resting. So they wanted to see if their exercise tests were valid when they had their patients wearing face masks, surgical face masks during the exercise test during COVID. So they had all their patients were wearing face masks in their clinic, to prevent virus transmission during COVID. And they compared these exercise tests to a matched group of participants from the previous year that were doing the same exercise test without a face mask. So for the participants that wore face masks in their study, that's 64 participants, 44% of them were females. You can see the average age was 63 years. They had some chronic conditions, so 8% had chronic obstructive pulmonary disease, 20% had coronary artery disease. And again, they compared this to a group of participants that had similar levels of disease the year before. They performed a progressive intensity exercise test on a treadmill while wearing the surgical face mask. So this test involves walking on a treadmill. The test becomes progressively more difficult as time goes on. So the grade on the treadmill becomes steeper. So you're walking up a steeper and steeper hill on the treadmill, and the speed of the treadmill becomes faster and faster throughout the test until the person reaches exhaustion. So this is what they found while wearing the face mask. The only significant result was that the group that was wearing the face mask had a higher blood pressure response during the exercise test. So you can see the difference, 182 versus 174 for your systolic blood pressure. But exercise performance, so the work performed during the test, was identical to the patients who did not wear a face mask. So they concluded from the study that the test was valid when participants were wearing face masks, and it did not impede their ability to perform the exercise test. So what is still unknown? The exercise tests that have been done while wearing face masks have included cycling or brisk walking. You can see light to moderate activity lasting 60 minutes or vigorous activity lasting about 15 minutes. What has not been done is, and this is a big criticism of the literature, is no one has really assessed the use of face masks during what might be deemed a typical workout, a workout that might be moderate to vigorous intensity lasting 40 to 60 minutes. So I know that there's a number of groups out there that are currently doing research. So I think that soon we'll find out the effects of wearing face masks during these typical types of workouts. So for this, right now, we can just count on kind of anecdotal experience. There are a number of exercise clinics and exercise gyms that are training people during COVID wearing face masks. This is an example of a gym in Halifax, that put in a request to be allowed to stay open during their restrictions. So this gym trains individuals one-on-one. You can see the trainer there, physical distancing, wearing a face mask, and you can see they have an older client doing strength training exercise, again, while wearing a face mask. So just anecdotal experience, with this gym, they haven't had any problems with their clients wearing face masks during typical training sessions. Some additional challenges while wearing face masks. So one concern is that the face masks become quite moist, either from sweat or water vapor during exercise. And another concern is that your glasses get fogged up while breathing hard while wearing a face mask. So, the concern with the face mask becoming moist is that there's concern that it might compromise the ability of the mask to block out, the virus or air droplets. And there is a recent review article on this topic. I've got the reference there. It's by Susan Hopkins, is lead author. She's a very well-known cardiovascular exercise physiologist. And her review article goes over all of the physiological changes you'd see while wearing a face mask. And in their article, they do cite some work where there's no apparent effect on filtering efficiency of face masks when they do become moist. A practical solution to this problem is, if you're training in a long session with a face mask and it's becoming wet, either from your sweat or water vapor, then a practical solution is just to bring multiple face masks to your training session and simply change the face mask occasionally while you're training. If you want to be completely safe, once you take off your wet face mask, then you should sanitize your hands before putting on the dry face mask. The second problem here is that glasses get fogged up while breathing hard while wearing a face mask, and this is a problem that a lot of people have stated that they get while wearing a face mask and exercising. This one surgeon has a practical solution that kind of went viral on Twitter, so he's been doing this for years. He just places a standard Band-Aid at the top of his surgical mask while he's wearing goggles or face mask, while he's wearing goggles while doing surgery. So the Band-Aid, blocks the air from going into your glasses, but the soft part, the cotton part of the Band-Aid is over the nose, so it prevents any irritation to the nose. And another solution is just to buy a bigger face mask. So if you can buy a face mask that's large enough to fit underneath the glasses, then that can help to alleviate the condition. This is the problem that I have when going out with a face mask. So the problem is that I often forget, to actually bring the face mask with me, and then I have to return to the house to pick the face mask up. Some additional questions, that have arisen. So, we focused extensively on whether face masks hinder, your acute exercise performance. There's some people have actually raised the possibility that if you wear a face mask during exercise, it may actually provide a greater training stimulus, and over time it might actually increase your performance. So I'm going to go over very briefly the theory behind that. For years, endurance athletes have been living or training in low oxygen environments. So either training at altitude or in labs where you have low oxygen pumped in, like air that's low in oxygen pumped into the environment. This is an example of a low oxygen tent that athletes often sleep in. And you do get changes in your oxygen carrying capacity, so it actually increases. It forces your body to increase the amount of oxygen that you can carry in your blood over time. And for some athletes, this has actually led to an enhancement in performance. And the one athlete I can think of that's most prevalent for Canada that's used this type of training is Becky Scott. So she's a cross-country skier who won a gold medal at one Olympics, and then the next Olympics she won a silver medal. And she uses a device like this low oxygen tent to actually sleep in, to expose herself to a low oxygen environment over time, to increase her aerobic capacity. And this comes from before COVID. There's actually a product out on the market called the Elevation Training Mask. So this is a mask that's been out there for quite a while, and it's been promoted to simulate a low oxygen environment. So the athlete wears the mask while they're training to try to get the same adaptation that they get while training, say at altitude, where you have a lower oxygen environment. So they're actually purposely impeding the amount of air that they can take in while they're training in an attempt to increase their sport performance. And I've just got a couple of references there. The work in this area has been very preliminary, so there's still some controversy out there whether actually wearing these face masks can be effective, for increasing your training adaptation. But what is known that, these studies have looked at athletes wearing these face masks during high intensity exercise being done over weeks of training, and they found no real adverse effects of wearing these face masks. And that is pretty much the end of my presentation, so I will open it up for questions.